Hello, today's talk is going to address the first major issues outside of normative ethical theory and in medical ethics proper. Today, what we're going to talk about is the all-important fundamental relationship between the patient and the provider. So we're thinking here about the medical professional and the client, or the uh, patient and that relationship. Now, it's going to bring together all of the areas and professions in healthcare in a way that no other particular topic within healthcare does address and bring them together. The relationship, of course, is built on trust. This is sometimes called a fiduciary relationship. In normal context, we usually put fiduciary within the banking arena, but in its root, it is one of trust. And so trust is a very important concept. Now, in order for trust to be there, the patient must believe that the professional is a professional, well educated, trained, is dependable, is honest. And these are all the sort of synonyms we might apply to try to understand the concept of trustworthiness. Now, if the patient feels that the medical provider is not trustworthy, then the relationship can likely break down. What I think you'll find, and the data seems to suggest this empirically, is that patients respond to caregivers and professionals who are able to make that kind of trusting relationship, right? And they will not follow up on advice or treatment or protocol if they don't believe or if they don't trust their medical professional. But this is a reciprocal relationship too, that healthcare providers have not only the duty to be trust worthy, but so do patients, and patients have to do their share too. And often it's quite common to feel as a medical professional that your patient isn't just doing the things that they're supposed to do, which are in their best interest. So it's a two-way street. And the first of the issues that we're going to be looking at in within this context are the issues around confidentiality. And confidentiality, of course, is key to medical and healthcare relationships because uh, the person divulging that information, which is private medical information, is the most personal kind of information, and people uh, want that information to be protected. So you have, as a professional healthcare provider or medical professional, you have duties to keep that information private, right? And in fact, there are several legal codes in most countries and states, and certainly the United States, that guarantee a patient's right to privacy. Uh, Confidentiality can only be breached in certain situations where there are mitigating circumstances that override the concerns for privacy. So confidentiality is the first of the major issues that you're going to be reading about and looking about in this particular um, module. And the others that constitute around here in this area include consent. And consent, and in the United States, there's a higher standard of consent than practice in other nations. It's called informed consent, and it describes a condition where the patient is given all the information they need to know about their particular case so that they can make the kind of decision that is an informed decision based upon rational decision making capacities. Informed consent is such a crucial part of medical and healthcare practice that it's found along with confidentiality in virtually every professional code. There's also a very disturbing and tragic history in medicine and science related to the lack of consent, where people were either bullied or worse, forced into um, uh, compromising and tragic and inhumane circumstances. We'll cover those more when we turn to the ethical issues around human and animal experimentation in a different module. And then there is the other concept within this module about disclosure. Disclosure is closely related to informed consent because in this instance, you are disclosing information to a patient, providing them with something, and the other side of the particular coin of disclosure is the right to know. The patient has a distinct right to know about the effects, side effects, consequences, costs, short and long-term effects, if they're known, about any particular medicine, treatment protocol, or intervention. And there falls on the medical provider the duty to disclose all of that information as far as they know it as well. So the issues within this context in this module look at confidentiality, uh, consent, and particularly informed consent, disclosure, and the right to know. The final topic you're going to be reading about is a talk about looking at the limits of science and medicine and what we ought to do in terms of creating the kinds of realistic expectations and assumptions about our care, about our practices. And finally, since trust is the most important concept and uh, within the relationship between medical provider and patient, uh, it behooves all of us to check our assumptions about people. Now, uh, some very important research has been done over the last couple of years as a result of the Me Too movement and the Black Lives Matter and other movements looking at explicit and implicit bias and privileges. And you should, of course, take classes and study and do a private self inventory about your own implicit biases. Because one thing is very clear that it's often the case within science and medicine that we don't check those kinds of normative assumptions very closely, and then we may bring them into the relationship, into the clinic, and uh, individuals can quickly discern and pick up on those types of behaviors that the healthcare provider may not even know that she is committing or he is acting on. And that immediately undermines the viability of the fiduciary or the trust relationship that is so essential, right? So um, learning about your own biases and being open and honest to the types of biases that you may implicitly hold, whether it's about race, gender, sexual orientation, ability, class, language, or what have you, is key in becoming the kind of caring and excellent healthcare professional. So, enjoy reading about these particular topics, and I'll see you next time.